Here are 10 Puerto Rico Medical Board style clinical vignettes focused on cardiac anatomy with 4 answer choices and detailed explanations. Cardiac anatomy clinical vignettes. 1. Heart chamber identification. A 55-year-old man undergoes an echocardiogram which shows a dilated left atrium. Which of the following is a possible consequence of left atrial enlargement? A. Pulmonary embolism. B. Recurrent laryngeal nerve compression. C. Aortic regurgitation. D. Tricuspid regurgitation. Answer B. Recurrent laryngeal nerve compression. Explanation. The left atrium is located posterior to the esophagus and near the recurrent laryngeal nerve. Enlargement can cause hoarseness, Ortner syndrome. Coronary artery supply. A 62-year-old male with chest pain undergoes cardiac catheterization, which shows a blockage in the left anterior descending LAD artery. Which cardiac structure is most affected? A. Right atrium. B. Right ventricle. C. Anterior left ventricle and interventricular septum. D. Posterior left ventricle. Answer C. Anterior left ventricle and interventricular septum. Explanation. The LAD artery supplies the anterior left ventricle and the anterior 2/3 of the interventricular septum. Extra 3. Coronary dominance. A 70-year-old woman undergoes an angiogram. It reveals that the posterior descending artery, PDA, originates from the right coronary artery, RCA. What is her coronary dominance? A. Left dominant. B. Right dominant. C. Codominant. D. Anomalous origin. Answer B. Right dominant. Explanation. In right dominant circulation, 85% of people, the PDA arises from the RCA. In left dominant circulation, 10 to 15%, the PDA arises from the left circumflex artery, LCX. 4. Cardiac borders on chest X-ray. A chest X-ray of a patient with left ventricular hypertrophy shows an enlarged cardiac silhouette. Which structure forms the left heart border? A. Right atrium. B. Right ventricle. C. Left atrium. D. Left ventricle. Answer D. Explanation. The left heart border is formed by the left ventricle and left atrial appendage, while the right heart border is formed by the right atrium. 5. Right atrium landmarks. During a cardiac catheterization, a catheter is passed into the right atrium. Which structure is found at the junction of the superior vena cava, SVC, and right atrium? A. Atrioventricular 8 node. B. Sinoatrial. C. Bundle of His. D. Coronary sinus. Answer sinoatrial. Explanation. The SA node, the heart's natural pacemaker, is located at the junction of the SVC and right atrium. Number 6. Venous drainage of the heart. A patient with right heart failure develops jugular venous distension, JVD. Which vein drains deoxygenated blood from the myocardium into the right atrium? A. Pulmonary vein. B. Coronary sinus. C. Azygos vein. D. Superior vena cava. Answer B. Coronary sinus. Explanation. The coronary sinus is the main venous drainage of the heart, emptying into the right atrium. 7. Pericardial layers and cardiac tamponade. A 47-year-old patient is stabbed in the left fifth intercostal space near the sternum. He becomes hypotensive and tachycardic. Which layer of the heart is most likely injured? Endocardium. B. Myocardium. C. Visceral pericardium. D. Fibrous pericardium. Answer C. Visceral pericardium. Explanation. The visceral pericardium, epicardium, is the outermost layer of the heart, and damage can cause cardiac tamponade, fluid accumulation in the pericardial space. 8. Aortic arch branches. A medical student is asked to identify the first major branch of the aortic arch. Which of the following is the correct answer? A. Left common carotid artery. B. Left subclavian artery. C. Right subclavian artery. D. Brachycephalic trunk. Answer, brachiocephalic trunk. Explanation. The aortic arch gives rise to 3 branches. 1. Brachiocephalic trunk, right subclavian and right common carotid. 2. Left common carotid artery. 3. Left subclavian artery. 9. Fetal circulation and ductus arteriosus. A premature neonate has continuous machine-like murmurs on auscultation. Which fetal structure has failed to close? A. Foramen ovale. B. Ductus arteriosus. C. Umbilical vein. D. Coronary sinus. Ductus arteriosus. Explanation. The ductus arteriosus shunts blood from the pulmonary artery to the aorta in fetal circulation. Failure to close results in patent ductus arteriosus, PDA, which produces a continuous murmur. HA10, cardiac septal defects. A child with congenital heart disease presents with fixed splitting of S2. An echocardiogram shows a hole in the atrial septum. What is the most likely diagnosis? A. Ventricular septal defect, VSD. B. Atrial septal defect, ASD. C. Tetralogy of Fallot. D. Coarctation of the aorta. Answer B. Atrial septal defect. Explanation. ASD causes a left-to-right shunt, leading to increased right atrial and ventricular volume. This results in fixed splitting of S2 due to delayed closure of the pulmonic valve. Final thoughts.